name is Vishnu Saxena. I'm a Digital General Manager Healthcare at the DXC Technology. I have two incredible guests this afternoon to talk about why consumer experience and clinician experience, and more accurately, consumer experience and healthcare workforce experience is critically important for health system to succeed, and why consumer experience alone cannot win this battle. So with that, I would like to introduce you to my dear panelists. Please meet Brian Carlson, Vice President of Patient Experience at Vanderbilt University Medical Center, also known as VUMC, based in Nashville, Tennessee. So VUMC is one of the largest and one of the most reputed, health system in the Southeast United States. And VUMC manages and serves close to 2 million patients every year. And VUMC is working with over 60 hospitals and 5,000 clinicians across Tennessee and 5 neighboring states, through the Vanderbilt Health affiliated network. It's honor to have you, Brian, here on this CHIME Media Live. And my other guest is Dr. Ashish Atreja, a clinician first, a clinician by profession, now the first chief innovation and the first chief information and the first chief digital health officer at the UC Davis Health. UC Davis Health is a Northern California region's only academic health center, and now the number one hospital in the Sacramento, California. And Sacramento is the capital of California and not the San Francisco, if audience are not aware about that. So UC Davis Health comprises of nationally recognized UC Davis Medical Center, UC Davis School of Medicine is a nursing school, UC Davis Medical Group. And while I was doing some research on UC Davis Health, I was pleased to learn that the world's first total body medical scanner was invented by UC Davis, UC Davis scientists. So it is widely recognized for its innovation culture. So thank you, Ashish. It's a pleasure to have you.
Thank you, Vishnu. It's a pleasure to be here.
Great. So let's get started. We have a tight schedule. So let's focus on the topic first, why consumer and clinician experience together is a strategic imperative post-COVID. So I will, let me turn, Brian, to you, and let me start this with you. As I understand from our, the previous conversation, and VUMC is a shining example where you have invested extensively early on in a physician administrative partnership. That engagement model has essentially translated and actually resulted into tremendous satisfaction at the VUMC when it comes to patient experience across all dimensions. So what led you to focus on healthcare workforce experience as a key means to achieve better patient experience? And if I can add a follow-up question to that, and how that has helped VUMC manage the clinician and the consumer experience much better than your peers during this now, COVID times.
Well, thank you, Vishnu. It's good to be here this afternoon, and welcome to everybody. So thanks for starting with that question. Experience, whether it be workforce or patient, is a journey. There's no endpoint to it. And we've taken the stance here at Vanderbilt, and I know many of my peers across the country have taken the same, that happy employees equal happy patients. If you do not have an engaged and happy workforce, it's very hard to deliver on that experience that you expect your consumers to go through. And I think that's the case in any industry, not just healthcare. We've taken the steps here at Vanderbilt where actually we have recently rewritten our mission statement to be much simpler, but actually to focus on both the patient experience and the workforce experience. So our new mission statement here at Vanderbilt is to personalize the patient experience through our caring spirits and remarkable capabilities. And if you just take a minute to think about that, it's really the remarkable capabilities and caring spirit of our people that delivers on that experience. So what does that mean day in and day out? I believe it means that we are giving our workforce the tools they need to do their job, that we're showing them respect in the workplace. We're building teams. It's that local work environment where people feel that value, that connection, and then we're creating where we're going, and people need to feel connected to that. And as long as we're meeting those broad level criteria, the workforce is gonna come along, and that remarkable capabilities and caring spirit is gonna come out, and they're gonna do what they do best, which is deliver world-renowned healthcare. And I thanks for the kudos about the difference in the peers, but I really don't think we're much different. We're all in this together, and we're all striving for the same thing. So
Excellent, excellent. Brian, can't be more agree. And Ashish, I would like to ask the same question to you as well. And you are in a unique position because you carry experience across both sides of the aisle. As a clinician first who has lived, survived, and excelled in that environment, say, then became the first chief innovation officer at the Mount Sinai. They started Sinai App Lab and innovation team. I remember spun off RX.Health, a prescriptive digital health, company. And now in your new role as a chief information and chief digital health officer at UC Davis Health, you are on the other side of the aisle and you are in a position to fix some of the problem that you faced during your clinician days. So can you share your perspective in terms of why you think clinician experience, or more accurately, as Brian suggests all the time, that healthcare workforce experience is critically important alongside consumer experience for a health system to succeed?
Happy to. There is a concept in research about mediating variable, which means that variable has to be improved. Then only you can get an outcome improvement. And I think what we somehow don't realize in technology work, patient experience is so much dependent on employer experience. If we can't create that aha thing, we cannot expect a patient experience to happen in vacuum. And Brian said it very well, happy employees is equal to happy workers. So in my role at UC Davis, I feel one of the reasons I'm here is the unification of traditional IT with the digital health, right? So many organizations are in different maturity level in terms of their digital health adoption. And really,
Right.
what we are realizing is the innovation should not be a side goal, a side speedboat. Innovation and experience has to be at the center part of the key operations, and that's where this new role is. And I call it our journey from innovation to transformation. So we really can transform holistically. So at UC Davis, we have put a goal of what we call as a digital Davis vision. And at the
Mhm.
center of the digital Davis is a digital experience. And the digital experience we not only want to give to our patients or the family members, but to our employees as well. And we have
Mhm.
even taken to take that experience to give to IT employees as well. Because if we don't give
Right.
to IT employees, then they may not be able to give that experience to their clients, which are healthcare workers. And then the healthcare workers can give the same experience to the patients. So it's a unification of that experience. And the good thing is we can use the same rubric of engagement and same rubric of technology. So we have put in our strategic goals, any new technology we onboard, we have a filter. Does that reduce the time for clinician or researcher? If that does not reduce the time for clinician or researcher, that goes way low in our totem pole in terms of prioritization.
That's so unique, Ashish. And I'm very excited to learn more about that. And in fact, we call it 360-degree longitudinal patient record, so that we understand that person behind that patient in order to serve that patient. And I think you're bringing that 360-degree culture in UC Davis Health to bring the employer, the IT team, and of course the patient at the center. So I think I love that. This is really great. Um, and so moving to the second topic, which is what are the providers' top consumer experience priorities in the new normal? So Brian, clearly no better than you understand that consumer experience is a new battleground, right? To re-engage, retain, and potentially, basically to make up for the lost revenue that we, lost because of the COVID. So what do you think are the top consumer experience priorities for the health system to succeed post-COVID? And if I may ask, where VUMC is focusing, where you're focusing?
Yeah. I'll actually take a little different slant. I would argue, Vishnu, that coming out of COVID, healthcare is at an all-time high because we saw the
Correct.
communities react to healthcare heroes and healthcare workers. And we did a study here at Vanderbilt, around the April-May timeframe when we were starting to think about opening back up. What was going to build trust in the community and whose voice was going to do that? And what we heard loud and clear from the consumers was it was us. They trusted us. They didn't trust the government. They didn't trust the public officials. They trusted their providers and healthcare systems that they invested, their care in as the voice of truth to what they could expect when they come back. And is it going to be safe? Can we keep them safe? So I think coming out of it, we need to continue to build on that because we're actually I would argue maybe at an all-time high in terms of that relative. So how can we continue to build on that goodwill and that trust that the consumer has with the health system? To give it more specific that, COVID brought a playground of innovative ideas. All of us had to build a brand new healthcare system in a matter of weeks to deliver upon, the experience to our workforce, keeping them safe, but then to the consumer, well, how are we going to treat them? And with any change comes these pockets of shiny gold. And one of those was not a new one, but hadn't taken off, at least here at Vanderbilt, and that was telehealth. Within 2 weeks, we had to stand up a robust telehealth system that had been there, but it had been being used about that much. And in a matter of 2 weeks, went from that to that. I mean, it was the magnitude of growth was unbelievable because everything moved now from in-person to via telehealth. So now, and then we got feedback from patients that they loved it. It was great. But now as we come out of it, what is that new normal for how we can continue to use telehealth, knowing that there are still things we need to do in person. There are disciplines of medicine that need to be in person. And frankly, we hear from consumers, sometimes they want to see their doctor. Sometimes they want to feel that stethoscope on their chest and have that physical exam. And you can't do that over telehealth, but there is a place for telehealth. And what is that right mix? We're researching here at Vanderbilt. I know every institution is doing the same, and every specialty is trying to figure it out for themselves. And I'm sure Dr. Archega can speak to it a little bit in GI, but it's a new ball field when it comes to that.
Excellent. And Ashish, you recently took the charge of the CIO and as the first Chief Digital Health Officer at the UC Davis Health. And I'm sure you have a lot on your plate. And this could be a little early question to ask, but if you can touch upon what are your priorities when it comes to improving consumer experience at UC Davis Health?
No, happy to. I think our CEO, Dr. Lubarsky, had this vision of one vision, one health with UC. And I think part of it is unification. So our goal in UC Davis Health is to actually unify technologies and unify experiences. Instead of having 500 different set of technologies and patients having different experiences, how can you bring it all together under a single platform approach? And that is built on from our work at Mount Sinai. So what we realized at Mount Sinai during COVID, when New York City was at the epicenter in April, and there were a lot of mixed messages coming on how to manage your COVID, how to even wear mask or not wear mask, right? So we felt it was our obligation to reach out to all our patients. So we rapidly turned on text to chat and text-based engagement. We were able to reach out through digital navigation, 1 million patients right from EHR, right? And 55,000 people we were able to recruit into a digital monitoring program within 8 weeks, right? So we are looking at bots, we're looking at text-based programs. And now in UC Davis, we're bringing all of them together under a common digital front door, where no matter where you want to be engaged with us, through a text, through a video, through an in-person, but we'll also guide you whether you need that urgent care appointment or not. And we actually had a very big legacy here in UC Davis. In 1992, we established the first telehealth center in California. And then we had a maternal fetal kind of a program that launched. So we already have a state-funded building, Center for Health and Technology, where we do a lot of simulations and kind of a lot of testing. So the goal is take those things which we have been doing, but really combine with the latest technology of bots and text, but unify it with the EHR and the MyChart framework. So to a patient, it's the same experience, and we are able to combine the data as well. So it's still a journey. It's still my first quarter here, but it's great to see how your unification journey and digital front door, then leading to digital monitoring, is coming together.
Awesome. Yeah, to build on that real quick, another initiative that we learned in COVID was the hospital to home initiative. That is now becoming a standard. We did it for COVID. Now we're figuring out how can we do it post-COVID, and it keeps the patient at home, so the patients love it. But it requires a whole new level of digital integration and experience, both for the clinician and the patient and the healthcare team, to be able to monitor those patients real time to know, are they still safe in their environment, or do they need some other intervention that's going on? But that's a whole new field that we're learning from.
And I think Ashish and Brian, you touched upon, both important things, digital front door and PCM Edge. And I think digital front door was already, getting lots of attention even pre-COVID. But I think post-COVID, as things are coming out, in my personal experience, lots of health systems are actually taking this initiative, because they want to provide that unified experience, not only to the consumers, but their own staff, the call center agents. So I call it, click it, call it, or walk in. So a seamless unified experience for, the patient to, come on the, website and the hospital website, make an appointment, all those, pay the bill and all, and they can do the telehealth and they can walk in, on the urgent care center or retail clinics and also, very well, excellent.
So another way to look at that, Vishnu, real quick, is another way to look at that is the idea of how much effort does the patient have to put in to engage with you. And the digital front door is really about making it simple as possible for them.
Correct.
But how can we measure how much effort do they have to put in to engage with you about their health? And the simpler we make it, the easier we make it, the more likely they are to engage.
Exactly. And that's how, you gain their loyalty. And because, there's a phrase, the increased digital intensity, your loyalty suffers. Because then the consumers are actually shifting and churning. Hey, let me see the price there. Let me see, what experience I get Mount Sinai versus New York City. I'm just, because New York City is a highly competitive, hyper-competitive market. So you're so right, Brian. Completely agree there. So moving to the topic 3 and 4, which I combined, the challenges and barriers in improving clinician experience and what actions, the provider leaders are taking to improve the clinician experience. So Ashish, let me come back to you on the segment, because you are a clinician first as a, gastroenterologist, now both as a CIU and the CDO. So what are the challenges and barriers you faced as a clinician, when you were practicing, gastroenterology, in Mount Sinai, in this environment? And I know Mount Sinai did a great work, as you mentioned, with the RX.Health during COVID to address some of those clinician challenges. And what are the actions that you are taking to make that better?
Yeah. So that's a great question. And I think if I can speak from my gastroenterology world, clinicians and every healthcare worker want to work hard. What they really don't like is the repetitive things that distracts from doing the patient interaction. So I'll give an example of that from GI perspective. We do colonoscopies for screening, has been shown to have a very big colon cancer prevention. Nationally, the trend of colon cancers in US is going down partly because of colonoscopies, recommended by everyone. But patients are afraid of it. And even if the patients agree to go for it, there's so many steps they have to do to be sure they are clean before they come for procedure, right? So nationally, 1 in 5 colonoscopies do not have a clean procedure. It's a $3,000 cost for a procedure that payers pay, right? So there's such a big inefficiency. And when we go,
right.
So the patients are calling us in the middle of the night how to do a procedure, like how to clean their bowel prep, right? Because they forget where they have kept the paper instructions that are given. So exactly. This is a perfect example. If we can automate all that patient experience that they have right in their smartphone, the instructions what to do, it saves so many back and forth phone calls, waking up in the night, and then doing a procedure but having to cancel it. Nothing is more frustrating than that. At one time, 7 out of my 8 procedures had poor bowel prep, right? So this kind of inefficiency is plugged into nearly every service line, whether it's surgical specialty, medical part, even in telehealth, patient has to be onboarded into an app for a telehealth, right? So if we can convert and automate these experiences through digital navigation, not only it can save the time for the clinician, they can focus more on the patient care. It also creates an aha experience for the patient as well, right? So I think finding the right fit of use cases where you can use the technology the right way, and then adopting that, so it becomes a transformation goal. No patient, no physician no researcher gets left behind in the right use case adoption. That's one of our mantras in UC Davis. Then we get everyone on the same footing in that regard. I still think
Fantastic,
it's a journey.
fantastic. I have a
Thank you.
Yeah, it is, and I think you are so right. This repetitive task and bringing these are the classic use cases where we can apply a technology and provide a better aha experience for physicians, and so there are tons of use cases, and I think the clinicians' involvement in solving the problems, through digital tools, I think that's just immense. I have a follow-up question with you, Ashish, because these days as we move towards a smart engagement, how to do that smart engagement, provide that better experience is through data. And we call these days data as a new solar, as a very fabric, from which a smart and evidence-based decisions are made, where clinicians and nurses can provide better experience and engagement, right? And it is only possible when data is presented in a highly contextual, personalized, and relevant way. So, we have lots of data flowing around, and many, but still it is too much in silos. And many physicians do not have access to that 360-degree insights, right? Or longitudinal patient record that can support that clinical and care management. So do you think a data-driven and data-rich, and maybe, AI and analytics insights approach could help, and, the healthcare stakeholders can enable, can use that and drive better clinician and consumer experience?
Absolutely. I would say it not only help, that's a necessary foundation, right? So for the colonoscopy example, we found 50% of patients who had an initial stool test positive only go for colonoscopy instead of 100%, right? 20% no-show rate, right? If you don't have a data, how do you identify the use case and the ROI and the value for it, right?
Correct.
And the data, even the part it's gone beyond claim-based data and merging with EMR data. I think we need to have frameworks in place to combine those data with patient-generated data, patient-reported outcome, device-generated data, to really have a 360-degree view of the data. We call it the new data combined with the old data, right? And only when we have it, we can automate the next best step for the patient. HbA1c is high, sugars are high, automatically the patient gets a reminder what is happening. Correct. And maybe automatically get a link to an appointment for a video visit because your sugars are high, right? So we call it, you really have to combine the data first approach, but the data alone will not lead to next best action step. Data will lead to insight, but you combine the data first approach with a digital first approach. So automatically, as you see a pattern, you are able to engage with the patient and navigate them through the journey.
Very well said. Very well said. Completely agree. And Brian, just touching upon the same thing, what challenges you and your team faced, and maybe still faces when it comes to improving clinician experience and nurses' experience, and how you manage it?
I think, like was said earlier, we have a similar goal that if it doesn't save time and save effort, then it's not necessarily an initiative we need to invest in. I think that the challenge we face is, I believe, problems are solved locally. The people who are doing the work know the problems they're having and probably knows the best solutions to do it. The challenges we face at system levels is, how do we scale it? How do we invest in and scale these initiatives on one front door, one platform? The amount of effort and resource that goes into integrating all the various apps when you have different platforms is, and I'm not an IT guy, but I see his head shaking, is significant. I mean, reams and reams and reams of people. So, so there's a happy medium there, because we got to get down to the local level and figure out what is the experience they're having, what are the struggles they're having, and then what technology can we deploy to solve those problems, versus, the shiny dollar of, ooh, that looks cool, let's go invest in that. And then we create more problems for ourselves, because not only are we trying to scale it and figure out how to implement it across the system, but it may not be really fixing the problem that they're having. It may be creating a new one.
That's very true,
Awesome.
Brian. If you allow, I think the scalability is essential to take it from innovation to transformation, right? Correct. So the couple of approaches we are using is, from technology standpoint, we're looking at app formularies and the platforms to really actually bring it together in an evidence-based fashion. And then from people and processes, Brian, we are looking at how do we scale education about innovation and digital health. So people are savvy users, We teach people how to be epic champions in EMR, but we don't teach them how to be digital health champions. So we are actually leveraging Node Health, the network of digital evidence, the nonprofit association. They have created a digital health foundation course. So goal is to make that course available to all our employees. So everyone knows how to maximize adoption of technology as well.
Correct.
So some of the things, which has been helping us, but I think we need to do much more of that across all health systems.
Correct, correct. And I call it an innovation is not invention without adoption. So if it is not adopted, there's no use of that technology or innovation. So we are in the last segment. We got a little over 4 minutes. So let me really quick touch with Brian and then you, Ashish. So how to reimagine modern consumer and clinician experience? And Brian, let me start this with you. So when it comes to transforming consumer and clinician experience, the big question always comes to where and how do we start? Right. And as a healthcare consumerization, picked up a couple of years ago, and there were lots of focus on a patient journey mapping, design thinking, and basically the objective behind was to truly design a patient-centric experience. So, do you think in that process, industry as a whole, and I won't say everyone, might have missed a little bit to include physician, nurses in that process, and putting effort towards understanding their journey and their pain points, their friction points, and then come up with a digital solution to address the problems. So what's your message to those who are on the journey of reimagining healthcare workforce experience?
I mean, no question. You need the inputs of everybody, because we all bring our own lens and perspective and our own experiences to what we're occurring. I think the challenges deploy solutions is the problem we're having, is it at scale, meaning it's across many patients or across many workforce members, or is it an individual to one person? And it's an individual to one person, well, then there's your solution, is that one person. But if it's an ongoing process and problem, and there's growing frustration among the workforce members, which could be manifested in many ways, lower engagement scores, turnover, increased complaints and concerns that are brought forward, those are all triggers to say something's not working well. What is driving that frustration? And then how can we work with them, because they know the problem and they also know the solution, like I said earlier. So that's where that journey mapping comes in, to help understand what the problem is, being clear on that, and then what the solutions could be.
Very well. And Ashish, real quick, having worked with you very close quarters, I know you are a staunch advocate of evidence-based innovation in digital medicine, and Node Health is an example of that. And you have built, variety of digital health solution that has provided wow effect to clinicians and consumers alike. So what's your secret sauce and message to the audience when it comes to transforming modern consumer and clinician experience?
That's a tough question. I don't know if there's a secret sauce. I wish there was a secret sauce. I can say, hey, I have a recipe here, a pattern.
That'd be a bestseller book.
I think the one thing that I would say is we just have to reflect on the bigger purpose, right? The value gets created if we don't do it because there's a regulation like 21st Century Cure Act. The value gets created, and we all know how much gaps are there in our care. It's just we have closed our eyes because we have accepted the way it is. The gastroenterologists have accepted giving a paper form is fine, and it's acceptable to have 20% no-show, and such a big kind of a poor bowel prep, right? So I think it's about opening our eyes, and every part of inefficiency now, we have tools now that can be fixed. And one of the things which we don't do as a science is we don't learn from each other, the health systems. The health system then don't learn from the health plans.
Correct.
And pharma doesn't learn from each. So there is no collaboration and co-learning that's happening. Because even if Vanderbilt is very different than UC Davis or Mount Sinai, I bet you 70-80% of the things that we are solving, or even more than that, are common.
Correct. Very well said. Yeah.
So things like CHIME, like other associations, we need to leverage those to learn from each other. And if the things is solved, like telemedicine thing was solved outside, we can rapidly adopt. Because no matter it's a rural hospital, no matter it's an academic hospital, it's the same process. Computer science has a basic thing of program which is repeatable. There are many things which are already repeatable and solved. We need to learn and disseminate, adopt them. And things which are not solved, then we together try to solve it. So that's, I think, the central message, how learning message.
Excellent, excellent. I think we are at the top of the hour, and Brian and Ashish, thank you so much. Wish we could have continued, and half an hour looks like a starter. Where's the entree now? So, so thank you so much for your time and very well thought perspective, and and Ashish, congratulations again, and Brian, thank you so much for joining. So, thank you all for joining. That's a wrap. The recording of this session, as Amy mentioned, would be available, and please follow CHIME at LinkedIn and Twitter. And Amy, thank you so much for your support and making this happen.
Thank you all so much for that incredible conversation. And I know many people will benefit from it, even if they weren't able to attend today. So thank you so much.
Thanks to CHIME.
Excellent.
Thank
you, Brian.
Yes, thank you very much.